think there are lots of reasons that healthcare organizations maybe haven't gotten here to this point or struggle with it. First of all, it's complex in that it is hard to gather all the different sources of data. So you have to spend both time, energy, and money like gathering data about the places that people can go for care and for food and housing. And it took us years to be able to build those algorithms and build those tools. So there is a upfront investment to be able to do this yourselves that I think people have really struggled with. The other biggest thing is that people, organizations, again, provider organizations, health systems, health insurance companies have really struggled with what do I do once I get the answers? We talk a lot in our work about the what, the so what, and the now what. And so they get the what, like understanding social risk at a person level. The so what is when you start to integrate our data from socially determined with healthcare data. And I can start to identify those, again, those subpopulations that might have a disease and a quality gap and a social risk need like food insecurity or housing instability. Great, so I've got that. Now what do I do? And I think what's happened over the last decade as we have matured as an analytic insight organization, the companies, vendors, and partners who are addressing and creating that now what. The Uber Health that can provide rides or prescription delivery or grocery OTC delivery, or organizations that are helping people address social isolation like PICS and REMA and others have started to create that solution. So now an organization, a health plan provider organization, not only can they have the insights, they've got tools and partners to be able to act on those insights to drive better outcomes.